AED. What is defibrillation? When the heart stops suddenly, as in cardiac arrest, it is frequently caused by an uncoordinated electrical rhythm known as ventricular fibrillation. A defibrillator is a device that delivers a controlled electric shock to the heart muscle to stop ventricular fibrillation. The heart's own pacemaker must then restore the normal electrical rhythm that is necessary to make the heart contract and pump blood. An electric shock from a defibrillator is the only treatment that will reverse ventricular fibrillation. An AED, or an automated external defibrillator, has a microprocessor that can detect ventricular fibrillation and permits the AED operator to deliver a controlled shock, that is, defibrillate the patient to assist in restarting their heart. Watch closely and we will run through the components and operation of an AED. You should note there are many different brands on the market. It is your responsibility to completely familiarize yourself with all of the features, requirements and functions of the defibrillator you have locally. For advice on purchasing an AED, FEC in association with University College of Dublin have produced an excellent document which offers a guide to AED suitability. It can be downloaded free of charge from the FEC website. Using an AED is important, but its deployment should not compromise ongoing good quality chest compressions. Therefore, it is far superior if one rescuer continues compressions while the second rescuer readies the AED for use. Some manufacturers do supply pediatric shock pads for use on children under 8 years of age. This is fine, however, non-availability of such pads should not prevent rescue attempts being made with adult pads. Infant AED. It is extremely unlikely to ever have to defibrillate a child less than 1 year old. Nevertheless, if this were to occur, the approach would be the same as for a child over the age of 1. The only likely difference being the need to place the defibrillation pads anterior, front, and posterior, back, because of the infant's small size. Simple identification differences between the two types will be made on the packaging. So let's watch Ross and Linda work through the use of an AED. Remove clothing from the patient's chest. Some AEDs will automatically switch on when the lid is opened. Other AEDs require an on button to be pressed.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
If another CFR is present, let him or her perform CPR while you turn on and prepare the AED for use. Make sure the chest is clear and ready for shock pads. Remove defibrillation pads from their packaging. The packaging will often have graphic images demonstrating the correct position for placing the defibrillation pads on the patient's chest. Place one pad on the right, just under the collarbone and above the right nipple. Place the second pad under the left nipple and in line with the center of the armpit. Correct positioning of the defibrillation pads is one of the most important steps of AED use. Correct placement ensures that the controlled electrical shock will pass through enough heart muscle and stop ventricular fibrillation. The patient must be unresponsive and not breathing prior to applying the AED pads. After placement of the pads, the AED will automatically analyze the heart rhythm or ask you to press a button to analyze.
Analyzing heart rhythm. Do not touch the patient.
If a shock is indicated, ensure that everybody is clear of the patient. Shout, "Stand clear."
Shock advised. Charging. Stay clear of the patient.
Press the shock button as directed by the voice prompt of the AED.
Deliver shock now. Shock delivered.
If the AED prompts you to start CPR, start chest compressions immediately.
Start CPR.
The defibrillation pads, once applied to the chest, should not be removed by the CFR. Great, now it's your turn. Using an AED trainer provided by a fellow participant, begin the full patient assessment and start CPR. If you remember to ask a colleague to bring an AED, they can deliver it after 2 cycles of CPR.